Good afternoon, ladies and gentlemen. I am Praveen Sirian over here, and I welcome you all to Brandcomm's first edition of Brandcomm Connect. For all those who are new to Brandcomm, here's a quick introduction for you all. We are a public relations company specializing in helping our clients tell their brand stories better. We offer public relations, digital marketing, and brand consulting services. Brandcom was founded by Mr. Ramanujam Sridhar, a veteran in the advertising industry and a man who needs no introduction. We serve over 60 clients in 6 markets, and we have over 58 highly skilled and enthusiastic professionals working with us. Brandcom is now part of Madison World, India's largest media buying agency. So, ladies and gentlemen, we have had the privilege of holding many offline summits, conferences in the past. However, the current pandemic has motivated us to leverage this technology. Nothing can match the experience of meeting people in person, shaking hands, exchanging cards, and seeing smiles on their faces. Nevertheless, we will keep meeting people, saying namaste, introducing ourselves, and smile, but all online at the moment. I'm sure this is also temporary, and the world will see those good times back soon. This leads us to the topic of the discussion today, analyzing when and how we can return to those good old days. I'm talking about what we had 3 months ago. We'll further discuss the role of employers as to what role do they have to ensure employees' safety at workplaces and their facilities. We have with us today the eminent Dr. Pratik Patil, who is a consultant for infectious diseases, Fortis Hospital, Bangalore. Dr. Pratik is a reputed physician with vast knowledge and expertise in infectious disease. His mantra is based on providing his patients personalized care, and he encourages patients to follow 4 healthy lifestyle habits. Dr. Pratik comes with over a decade of experience in the areas of HIV and related infectious diseases, tuberculosis, TB fever from unknown origin, community acquired infections, infection in organ transplant recipients, hospital infection control, and antimicrobial stewardship. So the list goes on. This is the vast experience Dr. Pratik has. So he represents Fortis Hospital, a brand that needs no further introduction. And I'm sure you would have seen the robot called Mitra, which was stationed outside every hospital, which did a fantastic job in screening each and every visitor, including doctors, nurses, medical and non-medical staff entering the hospital premises. Today's panel of speakers further include Dr. H.C. Guruvayurappan, who is the Senior Vice President at Omega Healthcare Private Limited. Mr. Dr. Guru, I would like to clarify, is a PhD scholar, and so that our audience are not confused that there are two doctors on the panel. He's a PhD scholar. Mr. Guru and we come across a long way. I know Mr. Guru from the year 2008. That's when Brandcom and Omega started their communication journey together. He has over 25 years of experience and as an accomplished strategic HR lead, bringing in organization and transformation processes, directing and sustaining the HR activities to accomplish business goals, coupled with excellent experience in liaising with the government, along with a strong industrial relationship and employee relationship. He additionally handles Omega's operations in Bhimavaram delivery location. He also brings with him knowledge from leading organizations and he has been one of the driving forces in building highly talented employee strength at Omega Healthcare. He's a postgraduate. He has a postgraduate degree in industrial relations and personal management, and a diploma in training and development from ISTD. In his decade-long stint in KPM and the KPO industry, Guru was instrumental in winning prestigious awards uh, for ALSEC technologies and for setting up benchmark HR processes for Paramount Airways. He was also honored as the CHRO of the Year at the World HRD Congress 2017. Guru is also a life member of Bangalore Management Association, the National Institute of Personnel Management, the Indian Society of Training and Development, and National HRD Network. Quickly, a few lines about Omega Healthcare. They are the leaders in the healthcare KPO segment with delivery centers spread across 4 cities in India and Philippines, providing revenue cycle management services powered by analytics and technology. Omega employs over 15,000 people across its 4 locations currently. Next up, we have Mr. Suresh of NR Group, who I know I had the fortune of working with him since 2007. Since Mr. Guru is the uh, Mr. Suresh is the Chief Operating Officer of NR Group, a Mysore-based conglomerate. NR Group has a flagship brand called Cycle Pure Agarbattis, which is India's largest agarbatti manufacturer. Suresh is an engineer by education and has had management training from IIM Ahmedabad. With his vast experience of 30 years, he manages the operations and all functions of the company, including finance, human resources, inventory, and logistics. He spearheads team building and ensures performance oriented culture across all units. Um, Quickly to talk a few lines about what brand Cycle Pure Agarbatti has done. They did a phenomenal job in the last 2 months to help people in their markets to handle the COVID situation by manufacturing and donating over 10,000 hand sanitizers to local authorities and giving over a crore rupees to the PM Care Fund. NR Group also has a famous brand called Iris Home Fragrances, which has created the home fragrance market and has been well accepted in the corporate segment too. NR Group was the first employer who paid their employees and their partners 10 days in advance and protect their jobs when everyone was facing uncertainty. And I remember Arjun Ranga, the managing partner who promotes the group, he went all to motivate people and his employees by assuring that business can be done later and people's lives are more important now. Before we jump to the topic, let me set the rules of the game. I mean, the format of the discussion. The three gentlemen will give their perspective of what is happening in the industry, and then Mr. Guru and Suresh would ask questions that they have, and they will also, in the last 20 minutes, um, pick up questions asked by the participants on the webinar who are HR professionals and CXOs in the audience. They will pick their questions, and the last 20 minutes we'll spend answering questions from the audience. I would like to mention that we have over 100 people on Zoom and a vast number of people on social media platforms. The audience also consists CXOs, HR facilities, HR and facility heads, and our dear friends from the media. I would like to wholeheartedly welcome you all. Over to you, Dr. Patil. Would you like to spend a few minutes talking about the virus and its impact on all of us now? Dr. Patil?
Thanks for the introduction, Mr. Praveen. So good afternoon all. I'm Dr. Pratik, consultant in infectious diseases from Fortis Hospital. Can I have my slides, please? So before I get slides, I think as everybody knows, the novel coronavirus or the SARS-CoV-2, which causes the COVID infection, COVID-19 infection, has put the world in his grasp over last 2 to 3 months. So these coronaviruses are basically a large family of viruses that are known to cause illnesses that can range from a very mild cold to moderate to severe illness, which can be as severe as a respiratory distress or severe respiratory syndrome. So in the past, there were two types of such illnesses called SARS and MERS-CoV. However, the novel coronavirus is the new one, and the COVID-19 is the infection caused by that. So, as I said, the COVID-19 is infection caused by the coronavirus, and because it was not known prior to the December 2019, it's called novel coronavirus. So, what are the symptoms? I think we need to know what are the symptoms so that we can identify the people who are suffering from such infection early. So the most common symptoms are fever, dry cough, and tiredness. These are the most common symptoms. And there are other less common symptoms which include body ache and pain, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, and skin rash with discoloration of fingers and toes. These are some of the less common symptoms. Few patients go on to develop breathlessness, or which is also called difficulty in breathing. That is around 20%. That is 1 out of 5 may get this serious infection and develop this. Now, the other side of this is that we should understand that 80% of the people recover without needing any hospital treatment or without any severe illness. So 80% will have only mild illness. Now, who are the people who are at higher risk of developing serious disease or complications? So it includes elderly people, more about above 60 years of age, those with any underlying complications, and underlying blood pressure problems or heart and lung problems, diabetes, cancer. So these are the people at high risk of complications. So you should understand that people of all age are at risk of getting this infection. Age doesn't prevent you from getting infection, but it's the outcome or the nature of the infection that is determined by the different factors. So in order to prevent infection, we need to know how the infection spreads. So it is spread through the droplets which are generated from the nose or mouth when people cough, sneeze, or they speak. So these droplets are relatively heavy and they do not travel very far, or they travel at maximum of 1 meter distance and they quickly sink into the ground. So that's why the social distancing is very important. So if you are in a vicinity of 1 meter distance from the patient with COVID-19, then you are at higher risk of getting infection. If you are maintaining a distance of more than a meter, then you are safe, even if the person is having COVID-19. The other thing is, the other important way how the virus spreads is by fomites. Now what happens is when somebody is coughing, sneezing, or talking, the infected particles can land on the surfaces around that person, like your tables, doorknobs, and handrails. And if the person comes back, the person who is not infected comes and touches those surfaces and can get contaminated. And if they touch their face, like mouth, nose, and eyes with such contaminated hands, they can get infected. So this is an important way of transmission of infection through your contaminated hands, the hands which are contaminated by the surfaces. Okay, so if you develop symptoms, what you should do and when you should seek medical care. So if there are minor symptoms, what you need to do is just take rest, take some symptomatic medications like a paracetamol. However, do not go to work or do not venture out. Stay at home. That is the most important thing. Stay home, self-isolate, and monitor your symptoms. And if you want to go outside, especially let us say in this situation, the only place you should go is a hospital or to meet a doctor. And in that case, you should wear a mask. Always try to keep a 1 meter distance from the other people and do not touch the surfaces with your hands, because you can contaminate those surfaces and which can lead to spread of infection. And after this, if you have difficulty in breathing, you should seek medical care immediately. So is it possible that a person may have COVID-19 virus but doesn't have any symptoms? It's possible, and that they may be harboring the virus without causing any symptoms, and they may also transmit the virus. However, we don't know how often it happens. So it's possible theoretically. So how can we protect others and ourselves if we don't know who is infected? So what we need to know is hand hygiene and respiratory hygiene. This is the reason I explained the transmission of the virus in detail, because if you follow the hand hygiene, which basically means frequent washing of your hands with either alcohol-based sanitizers or with soap and water, then the chances that you are going to touch your face with contaminated hands are less. And so the chances of getting infection is also further less. The second thing is respiratory hygiene. Now it applies to the people who are having symptoms. So if somebody who has cough, cold, or sneezing, they should use the handkerchiefs or tissue papers or a mask. If none of these is available, they should cover their face or mouth with the elbow so that the particles do not go in the outer space and they remain within the patient. So this is an important aspect. And maintain at least 1 meter distance between yourself and the others. This is another aspect. Now, what you should do if you come in close contact with somebody who has COVID-19. Okay. Now, close contact basically means you share the same house or same workplace. I mean, basically, it has to be a prolonged contact of more than 15 minutes within a space of 1 meter. That is what is a close contact. So again, I will say within 1 meter or a physical contact for more than 15 minutes is a close contact. So if you have just crossed somebody who is having COVID-19, doesn't mean you have got in contact with COVID-19. So this is one important thing. And if you become sick, you have to isolate yourself first thing. If you have mild symptoms, don't do anything, just isolate yourself. And if your symptoms are severe or if you develop breathlessness, you report to the medical, hospital or the doctor. And the quarantine period, in case you get diagnosed with COVID, should be 14 days. Because if anybody gets exposed to the virus can cause infection within 14 days. If after getting exposed, you have not developed any symptoms of infection within 14 days, it's less likely that you are going to develop it subsequently and less likely that you are still harboring the virus. So what about mask? Who should use mask? So what WHO, that is World Health Organization, recommends is mask must be used by healthcare workers, people who are sick and who are exhibiting symptoms of COVID like coughing, sneezing, and fever, or anybody who is breathless, and people who are taking care of person who is sick, so the attenders who are sick with COVID-19. These are the people who must use the mask to protect themselves or preventing the spread of infection. However, with the current scenario, all the governments are recommending use of cloth mask in public areas. Now you should understand that it's a cloth mask, not a N95 mask or a triple layer mask. These two masks are to be used only by the healthcare professionals or those people who are sick or who is attending a sick person. For a general public who is not having any symptoms or who doesn't fit in above 3 criteria, a cloth mask is good enough for the use. It is just to keep you safe from somebody unknown who may be carrying the infection. Now, these are the important things when you are wearing a mask. So before touching your mask, you should clean your hands with alcohol-based hand rubs or soap and water. You should always inspect your mask before you wear it, whether it has any tears or any holes. You should not touch your mask while you are wearing it for protection. After use, you should take off the mask with clean hands and avoid touching potentially contaminated surface of the mask, which is the outer surface of the mask. And perform hand hygiene after touching or discarding the mask. So this is important thing, because what happens is when somebody is using mask, they keep touching the outer surface of the mask, which is supposed to be infected, because it is filtering the infected particles from going in your respiratory tract. And if you keep touching that outer surface, you're potentially contaminating your hands, and with the same hands, if you touch your eyes, nose, or mouth, you can still get infected. That's why it's very important how you wear a mask and how you handle a mask. Okay, so that's why you should be very careful, because people are not familiar with the mask. They keep adjusting their mask very frequently, or if they speak, it's not comfortable, so they will pull down the mask. These are the important things to avoid that can actually increase your risk of infection. So I think yesterday we had some discussion where the topic was whether it can come from food, whether COVID-19 can be spread from food. No, it doesn't spread from the food. If you share a food, it doesn't. However, if you are sharing with close contacts, like while sharing, if you are sitting very close to each other and the next person has COVID, you can get a COVID infection like that. However, if somebody who had COVID infection, and he has prepared the food, the chances that the food will transmit the COVID is unlikely, because first, during preparation of food, due to heat, the COVID virus will get killed. And second thing, the virus needs active cells or tissues to multiply. In food, they don't have, so it will die immediately. So in general, food doesn't transmit the COVID infection. However, if you are using a common eating area or cafeteria, maintain social distancing. That should be enough. And as a good hygiene practice for food, food should be thoroughly cooked at least at 70 degrees, so that if there is any bacteria or virus, it will get killed. Now, when you are starting to work, like this is the topic of discussion, what else you need to do? Like hand hygiene and all these things, hand hygiene, use of respiratory etiquettes, and use of mask. All these are on personal basis that everybody has to do. However, when you are working in a factory or an industry, or maybe in offices, the surfaces in the office or the factory surfaces can also get infected if somebody is infected. So cleaning of the surfaces is also very important. So what are the disinfectant that should be used to clean these surfaces? So all the regular household cleaning and disinfectant products, like there are many, Lysol and things like that. They are useful to eliminate the virus from household surfaces. There is a separate list. You can find it on EPA. There is called EPA. There is a body. So most of them are there. Our routine, including Dettol and things like that, they can kill the virus instantly. Okay. So other recommended ones are sodium hypochlorite and the products based on alcohol, which should at least have 70% ethanol. That also can be used, but most of the common disinfectants are good enough to kill the virus. Now, I would suggest you to do the surface cleaning in every shift. If you have 2 shifts or 3 shifts, it's better to get it cleaned before the shift changes or before the shift begins. So get your surfaces cleaned after the shift, so that the next set of people who are joining the work, they should not get exposed to any infection or which is any infected particles which are produced by the people working in the previous shift. So what area should be prioritized for disinfection of non-healthcare settings. So any high-touch surface in these settings should be identified for such disinfection practices, which are basically your door and window handles, kitchen and food preparation areas, the countertops, different countertops, the bathroom surfaces, toilets, taps, and touchscreen personal devices if you have anything, any keyboard and work surfaces like your tables and all. So those should be cleaned thoroughly and properly. Again, which disinfectants are active? Some more on it. First of all, before cleaning the surfaces, it should be cleaned with water and soap to remove the dirt, and then followed by the disinfectant, because the disinfectant can get deactivated or inactivated by the dirt. So it's better to clean with soap and water first, followed by the detergent or disinfections, followed by the disinfectant. It should start from the least soiled area to the most soiled area, so that you don't make the less soiled area more dirty. And in indoor spaces, routine application of disinfectant to surfaces via spraying is not recommended. So it has to be cleaning with cloth, or it has to be wiped. Spraying is not recommended. Again, for public system, are those spraying tunnels or chambers, are they safe, or are they really useful? So they are not useful, they can cause problems and should not be used. So no for any spraying tunnels or chambers. Next slide. So what about gloves? We see that many people are using gloves to protect themselves from COVID. So is it really useful? So no, they don't protect you. It's as good as your hands. So if your hands can get contaminated, so the gloves can also be. So it's important that even if you're not wearing gloves, wash your hands before touching your face. That's the most important thing. And even if you're wearing gloves, again, still you have to use the hand hygiene. It doesn't give you any protection. The virus doesn't go through your hands, okay? It doesn't go through the skin. It goes through only the mouth, eyes, and nose. That's why it's important to protect that and not your hands per se. So now, what are the things that you should do while getting your workplace ready for COVID-19? So make sure that your workplaces are clean and hygienic. Surfaces and objects are to be wiped with disinfectants regularly after cleaning the dust. Okay. You should promote regular and thorough hand washing by employees, contractors, and customers. Basically, whoever is coming there has to practice hand washing very frequently and correctly. Put hand sanitizing hand rub dispenser in prominent places around the workplace and make sure that regularly refilled. You should display posters promoting hand washing. You should combine the posters with other communication measures. Like if you have some other types of meetings for different reasons, you can just spend 5 minutes in these measures, in those, so that there is a reinforcement of the message. And make sure that all the staffs or all the people who have access to your place, again, they wash your hands with soap and water. So hand hygiene is the most important. You need not have an alcohol-based hand rub all the time. Even simple soap and water is good enough. Now, another thing is you should promote good respiratory hygiene in the workplace. So again, you should have posters for the same thing, and you should communicate it in other meetings. So respiratory hygiene, I have already explained what are the things that they should do. Next slide. Again, if you have employees who are traveling out of the unit or out of the state or maybe out of the country, they should consult your advisors, medical advisor, or they should take appropriate precautions based on the government guidelines which are at that time. So these guidelines are changing very frequently, so you should keep updated yourself. Now, anybody with, this is important, anybody if mild cough or low-grade fever needs to stay at home. So this has to be clearly instructed to all the employees If they have even mild cough or low-grade fever, they should not neglect it and stay at home. They should also stay at home if they have taken simple medications. Like if somebody develops a fever and he takes paracetamol, his fever is gone. Even in that case, he should not report to work, because this is very common. And in the current scenario where there was lot of loss of work in last couple of months and people are desperate to go back to work due to different financial reasons and job security reasons. So it's very important to give them a clear message that their job is safe. Make it clear that they will be account this as a sick leave, and so that they report their symptoms and they do not hide anything, so that everybody is safe. I think from the management, that's an important decision to be taken. And you should develop that faith in your employees so that they come up with any symptoms if they have. As a unit, you should develop a plan what to do if somebody becomes sick or with suspected COVID or not at your workplace. So if at workplace, what happens if somebody develops cold, cough or fever while working? So you should preferably find a room or an area where such ill person has to be shifted before you are sending him off to a hospital or a doctor, and limiting the number of people who attend such sick person. So minimum number of people should attend and immediately contact the concerned health authorities. Now you have to identify, can you go back to the previous slide, please? Yeah. Consider how to identify people who may be at risk. Now, as I said, there are diabetic, hypertensive, or people with heart or lung disease who are at high risk of infections. So maybe you can make a list of all your employees who may be suffering from these kind of infections and give them an area which is less crowded, or keep special, monitoring for them. And especially you also should keep tab of your employees who have returned from other areas. So you should maintain a log of that as well. So I would conclude that now it's time to prepare for COVID. We cannot run away from COVID. We have to, battle it out. There are simple precautions that we have to take, and there is simple planning that we have to do. And all these simple things or basic things, I would say, that can make a big difference. So action now will help you to protect your employees and yourself and your business. So these are the simple things that everybody should follow, and the things will be better in that case.
Thank you, Doctor. Thanks for clarifying many of the fundamental and simple things, because these simple things are ignored and not followed by many. And now I would like Mr. Guru to ask questions that he thinks are very pertinent to his industry and his company.
So thank you, Praveen, and thank you, Dr. Patil, for giving us an exhaustive guidelines. Actually, some of the listed questions you have already answered, specifically. Just before I move on to ask the questions, the timing is much better for me to ask that Omega Healthcare last 30 days we have started talking about bringing people back to work. And about 60 days back, our focus was how do we deploy employees working from home. So when we look at the last 60 days, it is every day is a new challenge. And then now that we decided effective yesterday, bring back 5% of our workforce. That means close to about 450 to 500 employees across 3 locations. And we work in 2 shifts, day shift and night shift, so that we will experiment with about 50 to 60 in the day and night. In Tamil Nadu, they have not yet given clearance to work in the night shift, whereas in Karnataka, we have got clearance with a lot of guidelines, both in day and night. How do we maintain social distance, etc. And some of the things what we have done also is, as Doctor advised, use the deep cleaning methodologies, using steady fume treatment across the floors and workstations, cabins, AC ducts, etc. So one question I have here, which was also some of our participants asked, was, hey, all the AC offices should not be, switch on the ACs in the offices is one question. Predominantly government also were promoting. Whether the virus be transmitted through the AC in office, doctor. That is something which I thought I will clarify, because that has not come up in our guidelines.
Correct. Yeah. So see, I wanted to discuss it in person. That's why I didn't put much there on the slides. See, we have to understand again, the virus is spread by the droplet. It's not by the airborne. See, basically airborne is where you have a very fine, minute droplets or particles, infected particles, and droplets are bigger particles. Okay. So your COVID-19 is a droplet infection where the infected particles will not travel more than a meter. And if you have a common AC in the, so the chances that AC will spread it is less. Okay. So, but only other thing that because the air can get recirculated, so that is the only risk. So what we can do is just improve the ventilation.
Okay.
So you have to improve the ventilation of the area where you are using AC. Maybe you can use the exhaust fans in addition to the AC, and maybe a window should be kept open so that the new fresh air keeps circulating and the AC is still on with the exhaust. I think that is something can be done, because if you see, even in the hospitals, including all the ICUs and all, at least private hospitals again, there are areas which we have a common AC, and it's we have to work with it. Like in operation theaters, we have an AC, and we cannot switch off the AC in the operation theaters because it can lead to other complications.
Correct.
Right. So in that case, you should just maintain the airflow. There should be an airflow, and if you can do that, that's good enough.
And also one more, from the government guidelines recently we have observed, it is appropriate that companies keep the, employees or the persons with comorbidities to continue to be at home and work from home instead of work from office. And I did see some of your guidelines on the, people with illness on respiratory challenges or something. But in a common language, if we have to advise our employees, hey, you have, A, B, C, D kind of a thing, please refrain from coming, whether it is diabetes.
Right. So now that, so now that you have certain limitation on how much % of your employees can work, let's say around 33% or 50% in some cases, what I would suggest you is anybody less than, let us say, arbitrarily 50 to begin with at least. Less than 50 without any diabetes or any heart problem.
Okay.
Or any blood pressure problem should join the work as a priority, first place.
Okay.
And then the other people can join. So then afterwards, those with, let's see, age should be the last. So the elderly people above 60 or 70 should be the last to join. Okay.
Yeah. So I think that way Omega may not have a challenge. I am the eldest in the company. So my average age group is about 23, 25. So that may, ease out to a large extent in the BPO.
Correct. And in that age group, again, the other problems like your diabetes, blood pressure, and heart problem will also be less.
Correct.
So I think that is good enough for you, at least Omega, to go ahead. But in case any other industry, if they want to go ahead in a phased manner, I think they should go for this kind of strategy.
Yeah, I think, Suresh, I would request you to take over, because we have only about 20 minutes, and then we need to also, move on to the participants to ask few questions. So I would...
Yeah, over to you, Suresh. You can ask them. You have some questions.
Suresh, you are on mute, actually.
Unmute, Suresh.
Yeah.
Thank you, sir. Thank you, Dr. Pratik. It was wonderful. A lot of questions. Incidentally, a lot of questions that were in my mind have been answered. But since I come from the manufacturing sector, a couple of questions still remain for me. One, people are talking about self-declaration before making an employee enter into a premises.
Correct.
I have a problem here. See, I run a company, head of an organization, managing administration, couple of more than 3-4 places where there are more than 200 employees. And I have a couple of places where they are known as sales depots. There are around 35 sales depots in India, which are at high risk because a lot of lorries, loaders, unloaders, cleaners, these are the people who are entering into my depot with my staff ranging between 5 to 10. These are around 330 in number. And
Okay.
I also have manufacturing places which are between 50 to 350 employees in 16 places across the country. And hold on, I have one big challenge for me. All our agarbattis are packed and rolled in villages. They are around 10 to 15,000 in numbers. Sir, as I have been seeing this post-COVID and during the discussion, villages have come across much seriously than the people in the urban areas. Okay, that's one point I wanted to make. So for an organization of such a big horizon and magnitude with volume of people,
Okay.
is there any specific precaution that you want me to take? This, I have another 2 questions with this.
Okay.
The self-declaration is one. How does it help? Whether should I continue with this self-declaration before making any employee come for the first time to the factory? And the worst and the very important for me is the parcels, posts, this food which are coming from outside, and these are essential and non-essentials that are parcels that are coming through e-commerce, which are coming to the organizations, to the employees. These are the 2 high-risk things that I want you to answer, Doctor.
All right, fine. See, coming to the self-declaration, now that's the best way. That's why I emphasized while during the presentation also that we should give the, employees the confidence that they should declare themselves. They should not hide their symptoms so that they come up with that. That's one thing. Now, if somebody intends to hide it, what is the check? Another check. So maybe we can have a temperature check for them. So instead of self-declaration, if it's possible, like what we do in the hospital, maybe you can ask somebody at the entrance, question them directly, saying that, do you have a fever, cold, cough? 3 simple questions. If somebody says yes, he should not be allowed to enter the premises. So this is one thing. So because another problem with this is that somebody who has fever has taken the medication. While he's reporting to work, he may not have fever to check. Even if you check, you may get a normal temperature and he will still get through. So again, it comes back to the self-declaration. So it is up to the employee's honesty and his willingness to come up with those symptoms. There is no way to cross-check. You can obviously find out if somebody is coughing, sneezing while working. But again, unless you touch somebody, you cannot find out fever if they develop in meantime. So self-declaration is the only way. There is no test to do as such which can confirm at this moment for any asymptomatic person whether he is carrying COVID or not. There is no test at the moment. If you say that, okay, I want to test my all employees today, and if all negative, I can safely work. No, that's not possible because the test itself has many other problems. And it's the test, it's not a one-time answer. You may have to do it again and again, which is not financially feasible and not appropriate also in medical terms also. So any test is out of question. So it's only the self-declaration, maybe some questions at the entrance and temperature check. These are the basic things that can be done. Yeah. What was the second point? I think.
Second question on the post, the parcels.
Parcels.
That we are getting from outside.
See, it's very difficult who is handling the parcel, whether he was infected, not infected, which area it is coming. Again, it boils down to the basic things. Handle these things with hand hygiene. So you can open them, all of them together, handle it, read it, whatever. Wash your hands after that. And while working, also avoid touching your face. So even if you're working in a desk, office, anywhere, or in an industry, let's say some machines or something you are handling, do not ever touch your face. whatever happens, do not touch your face unless you wash your hands. You can carry a hand sanitizer in your pocket or somewhere if you have, on like this. In my office, it's always there in my OPD. So you can carry something on your, table or anywhere surface. So you can immediately use it. So anytime you want to use your, clean your face or something, wash your hands, then touch your face or wash your face. So that is the most important thing. You cannot trace the parcels where it is coming from and all, and you cannot, afford not to use any of these things. So you have to deal with it. The only way to keep yourself protected is hand wash.
Okay. Yeah, coming back to the guidance that you gave on the mask was a wonderful thing, which we also thought about it. Incidentally, what we have done is we have given four different color cotton masks. See, four different is only because they can continue to use it Monday, Tuesday, Wednesday, Thursday, and alternately again they can wash the one which was used on Monday for the Friday. So we, as I said, we have the volume of employees across the country, and what we have done is we have given, and that was a wonderful guidance that you gave on it. And another question that I had was on the virus part of it. That typically the question. How long a virus survive?
See, it depends on where it is. Okay. So, and what is the temperature and humidity on that particular area? So if it's on a paper surface, it can survive for 7 to 10 days. If it's on a metal, it's slightly less. And again, whether it's an indoor surface or an outdoor surface, if it's directly exposed to the sunlight, maybe even few hours. So it depends on temperature and humidity. Let's say if you are talking about letters and papers, what you are getting from the couriers and all different e-commerce companies, it may survive longer.
Okay.
So doctor, I have a question from one of the participants. Shobha Patil, she's asking, in case of internal fever where the warmth of the fever is not felt, and the thermometer does not show the rise in temperature, how can situation be handled?
Again, internal fever is very vague situation or very vague term. If you ask medically, the fever is defined as a temperature of more than 99 in the morning hours and more than 100 in the evening. So anything above this is called fever.
Okay.
Okay. So internal fever is not the best way to define it. And if they have fever or internal fever, sometimes what happens is before you get actual fever, there is some uncomfortable feeling. That's what maybe you are calling internal fever. That may be there. So they should just wait for a day, maybe if everything is okay or not. And if the fever actually comes, then they should continue to do that. If there is nothing more happening, they can resume the work.
Okay.
Doctor, there's another question from me. A lot of guidelines say that the vehicles and the vehicles that comes from outside, because I said we run a lot of depots where vehicles which would have passed through the red zones continuously for a few months or few weeks would have come to our premises. Right. And now the guideline says that they need to be sanitized. Do you recommend that? What is your suggestion on this? Because what we have done is we have taken this, as you said, the hypochlorite solution, and we are disinfecting the vehicle. We are disinfecting the tires, the handles. We're all the vulnerable areas of a vehicle, and we continue to let them in. While going also, we disinfect it and then we send it outside. Is there any particular guideline? Because these are the high risk areas for us. And also person inside these vehicles, the drivers, the cleaners, the loaders, unloaders, they would have gone to many places and they would have come to my position, to my factory. Is there any particular guidelines? Because this would be true for any other factories and my other fellow participants who are here.
See, again, as you rightly mentioned, it's very difficult to keep track where these patients, these people have stopped, whom they have interacted, whether they have taken precautions, whether they have any symptoms. So it's best to avoid the contact with them. And if you have to interact with them, maintain distance, follow the respiratory etiquettes. Maybe if they are not using, keep a distance of at least 1 meter, preferably 2 meters. Hand washing. If you are using a mask, that's better. That's the only thing I would suggest. As far as cleaning of the car, the different vehicles is concerned, again, it comes to handling. Let us assume the vehicle is contaminated with viral particles. when you are handling or when you are loading or unloading, due to the dust or the particles that are generated, that there is a risk, you know. So it's always better that you disinfect them, as you are rightly doing. Again, tires and all, I would not, you know, it may be a too much thing, but the area at least where you're working, like the, you know, the storage compartment of the vehicle. So at least that should be cleaned properly.
And I think another point that leads to the same question is continuous the usage of sodium hypochlorite in my team, particularly the depots and the manufacturing units. Does it lead to any risk?
No, sodium hypochlorite is basically you're a bleach, right? It's a bleaching powder.
It's a bleaching powder.
So make sure, so only thing about bleaching powder, it should be fresh. If it gets old, the chlorine content gets reduced further. So you should make sure that you're using appropriate quantity of chlorine in that, so that the disinfection is complete. Otherwise, you will just have a feeling that you're doing it, but it will not be appropriate. Okay, as such, it doesn't have any long-term side effects or any other problems.
Doctor, I have another question from people from the media industry asking this question. Is there any research or evidence that shows how long does a virus survive on paper? And because newspapers claim that it doesn't affect buying a newspaper.
See, again, on papers, it can survive for as I know, 7 to 10 days, I guess.
Oh, 7 to 10 days.
See, again, it has to be from an infected person. Right. Let us assume I have an infection, I am handling a paper, I have coughed, sneezed, and that particle has landed on the paper. That paper goes to the next person, he touches there, and then touches his, you know, face. That's how the infection is likely to spread.
Okay, Mr. Guru.
Incidentally, doctor, the time that we had for COVID gave us a wonderful opportunity. Cycle Pure Agarbattis came out with a hand sanitizer of their own, known as healing. So we did not waste time, you know, sitting idle at home. And we wanted to make sure that we do something to the society as well as to this country.
That was nice. I mean, nice initiative.
Yeah, nice to know about that. You know, fantastic, Suresh.
So Guru, you want to go to the next? You want to pick up any questions? There are a lot of questions coming from the audience.
Yeah, I think we should open. We have less than 5-6 minutes now. So I'm more than you know, happy to reserve my questions, and then more than happy to answer if any specific question on what we are doing in the industry from the participants. And then I will continue, you know, talking about what we did, you know, whatever doctor has advised. Definitely the communication in terms of ensuring social distance, and also the posters, especially all directions given by the government, and how do we ensure that, including, you know, each day, if the workstations are there, one workstation, next 2 workstations are put some cross marks with appropriate tapes so that it will never be used. Similarly, between the shift 1 and shift 2, we ensure that we have 2.5 hours gap so that the basic sanitization can be done. We also ensure that the van which we are providing, we provide only for a tempo traveler of you know, 12-seater, maximum 4 employees are only picked up because they have given that 1 meter. And so it is going to be a major, you know, cost factor. I'm only hoping government may relax, but government's guidelines is 40% of, you know, the seats can be utilized. So I think majority of those guidelines, 100% we are verbatim following at this point in time, including each table is removed from the cafeteria, 1 table, 1 corner, 1 person, and the other corner, another person. That kind of a numbering, naming, conversion, everything is put. But you know, more than that, it is again employees who are waiting to come to work from office, though you know, they have very difficulties. You know, work from home is all of a sudden came into this BPO industry, and then everybody were not ready to start working from home, especially people who are working in the night shift. They may not have a you know, private place in the home. Parents may be sleeping and they have to take a call from home. So these are all the people who would like to come and start immediately working, and the desperation for them to come and work. Also, they should not be hiding the fact that they have some feverish, or they have some kind of a symptom. So that is something. How do we address this? Continuously HR is following it up in addressing and then educating them now. Not to worry, you can be at home, and as doctor advised, we should extend that sick leave. So that we should be, the time I have seen from HR point of view, more than working from office, what we do in office, how do we emotionally make our employees feel comfortable, be at home? It is safe that you be at home, and then we will make you to come at when you and your family members are fully prepared to, for you to come and start working from the office. So I think that is something which we are also planning and continue to do already this 5% work.
That's very interesting and nice to know. Doctor, there's one more question from the audience.
Yeah.
Yeah, and this is relevant for all employers here. And even I don't have an answer for this. Is using of common toilets an issue here? Because when we come to work, these are all common toilets. So there's a person from the audience who's asking, is it a problem?
See, I don't think it should be a problem if it's cleaned frequently. And if you follow the basic precautions which I have already mentioned.
And what are your instructions to the office administration staff in terms of frequency of cleaning these common toilets?
So I think it should be cleaned at least 3 to 4 times a day. That's what I would say.
And not after every use?
Every use might be very difficult. If it's possible, nothing better than that. But operationally, it may be very difficult. Depends on areas,
Okay.
Doctor, I also have another question for you. Is there any specific guidelines to run a canteen?
No, I wouldn't say there are any specific guidelines for that. But I mean, cafeterias should not be a problem because the food which they are serving is fine because it's a cooked food, and you should maintain a social distancing, wash hands before and after the food consumption, and the people who are serving you the food also should maintain the hand hygiene. That is another important thing. So they should be clean. They should be, washing their hands frequently. Again, somebody who is sick should not work and self-report.
Dr. Patil, there's one more question from the audience here. The audience is a working mother, has 2 kids at home. And also this is a common question for many people who, after working here, go home. What are the precautions they should take? Because we carry a lot of bags and other things when we go home. So the question is around what precautions should be taken when they go back home. How do we again sanitize ourselves before entering house?
See, there is nothing special sanitization that is necessary. You can just take bath after going home. Maybe obviously everybody changes to a fresh set of clothes, and do not reuse these clothes. If see, again, you're talking about a non-healthcare industry.
Yeah.
Now, for healthcare industry, the risk is the highest.
Yeah.
We're going to deal with the people who are less likely to be infected. So there shouldn't be a very stringent or very drastic measures, but simple things like getting, a bath after coming back from work, and avoiding the bags and all, something that kids should not get in contact with them. That's the only thing. Just because they may be harboring, that's a remote chance. But again, that's the only thing. That they should not touch or play with those bags, or they should not come in contact.
Okay, then I think we have managed to close this in 1 hour. It's been an hour now. There are not many questions from the audience. There are few which we can respond to them one-on-one later. I think we've spent 60 minutes. This was quite valuable. There'll be still a lot of information, a lot of protocols that employers would want to take, and experts like you would want to share. This is a never-ending process. I don't think the situation would change anytime soon. While we all have decided to partially work from office, partially from home, the markets have opened up. The numbers are not coming down. I think the future is to live with this virus and learn to deal with it bravely. Many more instructions can be shared. People will learn to pick these things up, and office administration will bring in a lot of discipline. I think this has brought in a lot of discipline in terms of hygiene in the entire world, not only in India. I think this was a fantastic experience of learning from each other, sharing the best practices from one company and the other. It was interesting conversation. I think we would take this opportunity to thank our participants first, the media partners, and all the three participants, the three panelists here. So you thank one and all, and we'll have many such topics discussed on this platform called Brandcomm Connect, which will help a lot of companies and public at large to understand many aspects. We might have a session every 15 days with many experts coming from different industries. We would like to thank one and all here and end the session. So we would especially like to thank our media partners, the people management group here. Thank you one and all. If there are any other questions, we would like to answer them on the other platforms.
Thank you so much.
Okay, thank you, panelists. Yeah.
Just one concluding remark from my side. I think these are the basic precautions which we have learned because of COVID should stay with us even after COVID. This will help you in a long way for any infection.
That's one of the reasons India is becoming India is more comfortable than any other country, because our upbringing on itself was on social distancing and all these simple super hygiene lifestyle. I think we are all blessed to have born in India in that sense.
Yeah.
Agree.
Okay.
Thank you.
Thank you.
Thank you so much.